Bismillahirrahmanirrahim. Assalamu alaikum. A 46-year-old man is brought to the emergency department after a fall during a downhill bicycle race. The patient lost consciousness for approximately a minute and has severe back and abdominal pain. He has no other medical condition. CT scan of the head revealed no intracranial bleeding. CT scan of the abdomen demonstrates a small retroperitoneal hemorrhage and renal laceration. Lumbar X-ray suggests a compression wedge fracture of the L2 vertebral body and a brace is placed. The patient renal laceration and lumbar fracture are managed non-operatively with analgesic and supportive measure. On hospital day 3, the patient has mild diffuse abdominal pain and nausea. The abdomen is distended, tympanic, and mildly tender without rebound or guarding. Bowel sound are absent. Upright X-ray of the abdomen is shown in the image below. So this is the image upright X-ray of the abdomen. So which of the following is the most likely diagnosis? So this patient is 46-year-old man. He is brought to the emergency department after a fall during a downhill bicycle race. The patient has severe back and abdominal pain. CT scan of the abdomen revealed a small retroperitoneal hemorrhage and renal laceration. Lumbar X-ray suggests a compression wedge fracture of the L2 vertebral body. Patient renal laceration and lumbar fracture are managed non-operatively, but on day 3 of hospital, patient has mild diffuse abdominal pain and nausea. Abdomen is distended, tympanic, and mild tender. Bowel sound are absent. Based on these hints and the X-ray shown here, the diagnosis of this patient based on these hints and the X-ray finding here is paralytic illeus, and here the correct option is choice D, paralytic illeus. So paralytic illeus is commonly due to abdominal surgery, but can also be seen in retroperitoneal abdominal hemorrhage, intra-abdominal inflammation, for example from pancreatitis, intestinal ischemia, and electrolyte abnormalities. Symptom and sign include nausea, vomiting, abdominal distension, obstipation, and hypoactive or absent bowel sound. Abdominal radiography classically reveal uniformly dilated gas-filled loops of both the small and large intestine. Management of paralytic ileus is conservative and include bowel rest and supportive care and treatment of secondary causes. I will show the photo of the paralytic ileus. So this is the X-ray of the paralytic ileus. On the left side, this is a normal X-ray. On the right side, this is a paralytic ileus, which show that here is the gastric dilation, gastric fundus dilation. Here is the gas-filled loop of the large intestine, as arrow shown here, and here is a gas-filled loop of small intestine, which show that there is a paralytic ileus. Come to the incorrect one. I will explain choice A and E together because these both are related. Cecal volvulus and sigmoid volvulus. So most common site of volvulus in adult are cecum and sigmoid colon. X-ray reveal a transition point at the cecum or sigmoid colon. Patients are usually much older than this man and have a more insidious onset of symptom. Neither cecal nor sigmoid volvulus is a common complication of trauma. Choice B, complete small bowel obstruction. So in complete small bowel obstruction, the bowel distal to the obstruction is not distended. Hyperactive tingling bowel sound are typically present on physical examination. Choice C, gastric outlet obstruction. So patient having gastric outlet obstruction on X-ray, there will be only dilation of the gastric, not other small or large bowel. Choice F, viscous perforation. So patient having viscous perforation on X-ray, there will be free air under the diaphragm. Thank you.